just typical children, they might still be able to socialize normally, right? They can communicate whatever they want, right? Yeah, and children with ADHD might have struggles in that components.
Yes.
Okay. I think we have one question specifically. I would say it's for OT. What are the specific reasons behind my son being energetic even when I control his sugar intake?
Okay, for this question, I think this question popped up yesterday, and I do some research about that. So, first we need to know why we want to control the sugar intake. So there have a lot of parents listen about we need to control the sugar intake, but we need to know the reason why behind. So for a research in 2021, if the children have too much sugar, the sugar will be related to the dopamine receptor.
Right.
So the increase of sugar will decrease of the activation of dopamine receptor. So what will affect is like your body will have a lower dopamine level compared to others if you have extra sugar. So what that will affect is the dopamine levels is highly related to the prefrontal cortex. So there is a brain area in front of here that is called prefrontal cortex that is very related to your function of inhibition. So we know that the ADHD children, they have a lot of impulsive. So inhibition function in the prefrontal cortex is one of the main person that in charge of how we can inhibit up with all of these impulsive. Like for example, like I want to go eat something. I'm hungry, but I'm in an interview. So I will inhibit my needs of eating something by cognitively inhibit it, like okay, I need to finish this and I can only go eat something else. So I'm like mentally inhibit myself. Okay, I'm going to do this one first and that's one. So this is a function of the sugar intake. It's like when we decrease sugar intake, this one will be improved in the ADHD kid. But we know that for the term of self-regulation, there is two ways to doing that. So first, we can use our highly mental to inhibit it, but you are using our cortex inhibit it. So that I have a lot of impulsive, but I'm going to inhibit it. Like I'm hungry, so I'm going to like tell myself, no, I can't eat right now. I have something more important to do. But we got another way, is from bottom up, to directly decrease the impulsive. It's like if I'm hungry, so I eat something before the interview, so I won't feel that much of impulsive.
So you're saying it's like up-regulating and down-regulating a child, right? So
not exactly. That is both down-regulating the children, but it's one way is using the top-down approach, another way is using the bottom-up approach. But that's a difference. So when we go to the attention, there are two ways to do that. So one way, I force myself to attend. Like I need to, so I'm mentally telling myself I need to attend. But another thing is like, the thing that distracts me is decreased. Like I'm not that hungry, so the impulsive is not that severe. So that is like bottom up. We decrease the impulsives coming up and not like directly inhibit it. So that may make us to feel more easy to do that. Easy to do that because we don't have that much of impulsive need to be inhibited. So we come back to this question where we know that what the sugar intake will affect is that the sugar intake will only affect one of the way, is the top to down. So how about the bottom up? So the sugar intake do help the children to make them with more attention, but it's not enough. It's not enough. it still have another part where we need to take care of.
Right.
Yeah.
So that another part is for the parents to figure out what is it.
That's why it's mostly we do OT inside the session.
Okay.
We use a lot of movement, a lot of like sensory things to help the children to be easy to regulate themselves.
Okay, got it. Okay, alright. Okay, maybe this question can be for Miss Kitty. What are the activities that parents can do with kids at home?
Alright, there's so many activities that parents can do at home, especially with children around age 3 to 5, even in school age, in the primary school age. So we need to set up our goals. The parents need to find out why they want to run the activity. For example, like they want to improve the child's attention. That's it.
Right.
So they can play like their favorite puzzles, om sound, mindfulness activities, relaxations like child yoga poses, and dancing activities. So all these movements and all these activities will increase the child's attention. And for improve the social skills, the parents can play role play activities and also group activities such as involved in sports, family running, family hiking, and also they can always encourage children's interests and also hobbies.
Right.
Yes.
So whatever the kids are interested in, that's where you engage in that kind of activities lah.
Yes.
Right. I think one important thing that you mentioned just now, even with kids that 2 to 3 to 5 years old, right? You can still do something without them being diagnosed.
Yes.
So I mentioned just now that kids, we only diagnose kids who are 6 years old and older, right? But then when kids are below 6 years old and you see signs of ADHD, right? You can still do all these activities just to help them, maybe with their attention. It's like skill that you train in lah, right?
Yes.
You don't necessarily need to be diagnosed to start doing it, but you do it even before that.
Yeah.
And then okay.
So to find out what really helps the child to improve their symptoms like the inattentiveness, they always can come and consult their therapist. And they find out the right approach to help that child.
Okay. Simon, this is a question that pops up in my mind lah.
Okay.
How important is early intervention? So even before 6 years old, you want to get diagnosed. How important is
Early intervention.
correct doing the therapies before that?
Early intervention, there's this question. First, we need to know what is early intervention. What is early intervention in your mind?
Meaning, okay, for example, we do see kids here 2 years old, 3 years old coming for occupational therapy, coming for speech therapy. Why is it important? Like, we're not diagnosed, right? Why not just wait until 6, 7, 8 years old, then only do therapy?
Okay, so here it's like the intervention we do before 6. It's all the intervention we do before 6. So I think this question is good. Let me think how to answer this one. Okay, for one, I think if we wait the children until 6, just decide what we're going to do in the intervention. I think there's a lot of things we missed out at 6. So the time between 1 to 6 or 0 to 6, that gap is we need to chase back after he's 6 years old. So that would be a big gap. So if we can have more sign and we can know that okay, this is some of the sign for the ADHD. Even if you don't diagnose, but maybe do something in the treatment will help him to be easier at the future life. I think we can start earlier, not necessarily need to wait for the diagnosis to come up. And I think that would be a good thing to help the children to catch up. Even though like the speech also, if you start earlier, that can benefit more.
So again, it's to catch up with the age appropriateness, right?
Yes.
If the kid is 2 years old but he's supposed to be doing more, then that's where the early intervention will help
Yes.
catch that up.
Yeah.
Mm.
So the parents can always refer back to the milestones. Yeah, and also the very obvious, very symptom they can see is always from speech perspective is speech delay, and difficulty to communicate with his peers, and yeah.
Right.
Yes.
Okay. Yeah. I think I like your explanation in that sense. The next question is, how is ADHD in childhood different from adulthood? Change your brain. You don't suddenly change your brain at 21 years old, right? It's there since you're a baby, right? So you don't. I know nowadays people get diagnosed with adult ADHD. That's currently one common thing. But then when you come to a professional, we will always ask back when you were a kid, how was it for you?
Yes.
So now, how to differentiate between adult ADHD and childhood ADHD? For me, it's still ADHD. It's just when you realize it. Okay.
We have a question from WhatsApp.
Okay, let me finish this question first. So adult ADHD, it's still ADHD, but most of the time the adults can cope with it already. So they have their own strategies already. For example, you have problem with time management. So you put alarms every day at 3. You have to do this, for example. So you have your strategies lah, with alarms, with timers, with to-do lists.
Yeah.
So that helps with organizing. And with adults, they have gone through this for example 21 years. So they have lived through it and they have found what worked for them.
Yes.
So I think that's how it different lah, the ADHD in childhood and ADHD in adulthood.
Yeah.
That's how it's different. Simon, you say there's a question.
There's a question.
Okay.
It's called
Okay. There's a question from live stream. What happens if we don't catch it early? Okay. Yeah. So I think this goes back to the early intervention lah. If you don't do the early intervention, what happens next?
Yeah. So without therapy, so every children will go into the school, right?
Right.
In the education stream, we call that. So there, children might have various challenges, especially focusing on their academics. So they might show poor performance in the educational part.
Right.
Yeah.
Right.
So that's why after most of the children, they come after they go into the kindergarten.
Right. And then the teacher complains.
Yeah, the teacher
and then
complains,
the parents
yes.
will come.
Yeah.
Right.
Yeah.
So yeah, I agree. I think when you get undiagnosed, what happens is you struggle with the communication, with socializing, and then in future when the child becomes a bit bigger and they can think, they would think, why am I like this? It's my problem, it's not other people's problem, right? And this might lead to, on my side again, this might lead to mental health because you will blame it on yourself. I'm not good enough, I cannot finish this, I cannot socialize with other kids. Why am I having this problem? So I think that's where the difference is.
It also causes low confidence, less confidence to achieve anything to do in their life. Like they don't want to try any new activities. Like, they just feel low all the time.
And again, I think it's not to label the children, but it's more to allow them to understand what's going on with them and not to blame it on themselves. There is a reason behind it lah, basically. Yeah. Is there any other questions, Simon?
I think that's all.
Okay.
I think so.
Alright. Since there's no question, would you guys like to wrap up? Okay. The topic is big. Childhood ADHD in children, right? What is one advice you would give to parents?
Sorry?
What advice you would give to
Advice.
parents that's watching this live? believe.
So our aim by providing early intervention and also therapy and support in various settings is to give more than one way to achieve their expectation and ensuring that they can succeed both inside and outside of the classroom and their entire life. So I think that's all for today. Please come back next time. Next week we have a topic from a speech therapist and we have a lot of questions to answer, and please do follow us. Yeah.
Simon, any last words?
Yeah, for OT, I think we do the simulator with speech. It's just like in another way of doing that. And speech focus more on language, so OT will focus more on the attention and all the self-regulation thing in ADHD children. Include the exclusive function. So yeah, we just want to help or support the children to do what they want to do in their life and not let this diagnosis or their inattention to distract them in their daily living.
Alright. Yeah, I think there's a lot more things to say about ADHD in children, but the time is not permitting us. But yes, please stay tuned for our next live stream, which will be next Wednesday, and we will be getting our speech therapist. Kitty will join again next week. It's from 12 to 12:30, so come again and don't forget to like, subscribe. You can go to the comment sections for the links next week.
Thank you.
Alright.
Thank you, everyone.
Thank you, everyone. Bye.